at the base of the fire. Squeeze the top handle. This depresses a button that releases the pressurized extinguishing agent. Sweep from side to side, until the fire is completely out. Start using the extinguisher from a safe distance, 2 to 3 meters away, then slowly move forward. Once the fire is out, keep an eye on the area in case it reignites. Fire hose reel. Open valve fully. Pull out hose. Open nozzle. Aim at base of fire. Do not use on live electrical equipment. Fire classification. Class A. Like paper, wood, plastics, etc. Class B. Flammable liquids. Like solvents, oil, paint, etc. Class C. Flammable gases. Like propane, butane, etc. Electrical. Energized electrical equipment. Like computer, servers, motors, etc. Fire extinguishers. Portable fire extinguishers are essentially to be used on fires in their early stages. All fire extinguishers will have a label telling you which type of fire the extinguisher is designed to fight. Do not take unnecessary risks. Type of fire extinguishers. Carbon dioxide, CO2. For fire type B and electrical fires. Dry powder. For fires types A, B, C. Carbon dioxide, CO2. Advantages. Non-conductor electricity. Penetration of small spaces. Non-toxic. No damage and clean. Disadvantages. Noisy during operation. Little care in case of reignition. Fire extinguisher, dry powder. Advantages. Rapid in-action knockdown of flames. Disadvantages. The powder does not cool the fire. Fires reignite, no cooling effect. The powder does not penetrate small spaces. Fire extinguisher, dry powder. Has pressure gauge to allow visual capacity check. Should be in the green. Any other position should be recharged. Carbon dioxide, CO2, extinguisher. Worked by smothering, and effective against type B and electrical fires. Multi-purpose dry chemical, ABC extinguisher. Worked by smothering, and effective against type ABC, and electrical fires. Steps to operate fire extinguisher. Leave immediately if you're unable to extinguish the fire. Make sure to stand 2 to 3 meters away from the fire. Stand with your back to an exit. Evacuate a room that's filled with smoke. Evacuation. For the inpatients, the evacuation will be horizontally, stage 2. When evacuation is announced, the fire marshal will shut down the medical gas valves or assign someone to close, after providing of portable oxygen cylinder, ambu bag. Whom we evacuate first. First, ambulatory patients. Next, semi-ambulatory patients in general care units requiring transport assistance. Then non-ambulatory patients in intensive care units. Operating room. It is important to note that an ongoing surgery should be completed to a point of safety, before moving the patient. There are 3 stages of evacuation. Stage 1. Zone evacuation. Stage 2. Horizontal evacuation. Stage 3. External building evacuation. Stage 1. Zone evacuation. Movement of patients and personnel away from immediate danger to areas within the same fire zone. This usually involves the movement of a few patients away from the fire to a safer area within the ward. Stage 2. Horizontal evacuation. Movement of patients to designated evacuation zone on the same floor, horizontally. This is the most common form of evacuation and is the type of evacuation practiced during fire drills. Stage 3. External building evacuation. Movement of patients and staff completely out of the building onto the designated fire assembly point.